Hello, and thank you for joining us for this very special donor reception. We begin at our East of the River Community Health Center. This is the health center dedicated to Dr. Janelle Getches, our founder, and it is our newest health center. I wish we could all be together in person so I could personally thank you. But today it is an honor to welcome you and to celebrate Unity's 35th anniversary.
Good afternoon, special friends and partners. Thank you all for joining us on this very special day to celebrate you. I'm Teresa Acquaviva, and I'm joining you from Unity's Brentwood Health Center. As a longtime family nurse practitioner here at Unity, it is an honor to welcome and to recognize your generosity on behalf of Unity's board, staff, and patients. As Unity's first ever virtual donor recognition and appreciation event, we're here especially to recognize a few transformational donors and to celebrate all of you who, in the good times and now in these not so good times, continue to stand by Unity. Whether you are a longtime supporter or new to the Unity family, speaking for all frontline workers, we are inspired by your philanthropy, by your generosity, and your kindness. And we truly want to thank you for your caring because it is essential to Unity's mission. As you know, Unity serves over 104,000 individuals annually, regardless of their ability to pay. We are all in the middle of a deeply strained and fragile time. Just months ago, phrases like COVID-19, social distancing, or teleworking would have seemed foreign. And yet, these now form part of our everyday speech. In these past months, Zoom, Skype, and Google Meet have become essential tools to our everyday connection. Face masks are now a norm. And supporting people throughout our Unity community is ever increasing. And there are days when we wonder, how will we continue keeping the families within our communities healthy and safe? However, just as Unity has for 35 years, Unity will continue to stand strong for another 35 years, providing quality and compassionate health care. So, in the coming hour, we invite you into the experience of staff and patients as they reflect on the challenge and the resilient hope they claim in the present moment, and show how we will continue to serve for another 35 years. We will tour Unity's Parkside Health Center and a COVID-19 tent, debut our new health mobile, generously underwritten by CareFirst Blue Cross Blue Shield, and we invite each of you to walk alongside our homeless walking outreach team. We'll also share with you about our ongoing commitment to promoting healthier communities through compassionate and comprehensive health and human services, regardless of one's ability to pay. So, welcome to Unity's Donor Appreciation event, and we invite you to join Vince now as he takes you on a tour of our Parkside Health Center.
Hello again. Today we're going to take a look at one of our equally new and beautiful health centers called Parkside. Parkside serves the southeast community of DC, and we provide great care with a multiplicity of services which you'll get a chance to see. And I'd like to start off today with showing you the pharmacy. Our pharmacy, you might think, is a traditional thing to have in a community health center or in any clinic, but it's critically important for the patients that we see here because many of them have chronic illnesses. And having access to a pharmacy on while they're in the health center is critical and important for them in ensuring that they have access so that the conditions that we're treating them for can be taken care of pharmaceutically. We'll take a trip now to the Stork's Nest. Very small part of the service we provide for children within the community health center who are pregnant mothers and little children who can have access to clothing and other services. I'd like to take you in now to this, as I mentioned earlier, this Stork's Nest. It's supported by March of Dimes and also by a sorority of the Howard University. Cute place for our young mothers to come and get clothing. Tiny room, but full of lots of great things. Things that are donated by various funding sources, including Howard University alumni. The mothers come in, get what they need when they're pregnant and right after they give birth. They come in and choose the various elements that are necessary in early stages of raising a children. We also have lots and lots of educational material for the mothers and the fathers who are involved in rearing these children that are very special to us. So we're visiting now the OB clinic, which is really a critical source of care for our pregnant mothers or those who need surgery. This is any community health center. This is an important part of their mission. We have many pregnant women, and as you may know, the District of Columbia has a high incidence of both maternal mortality and as well as infant mortality. So Unity, along with its partners in this particular clinic, is playing a very important part in improving health outcomes for pregnant mothers. The services provided here are critical to any community health center, and particularly critical in Washington, D.C. These are the OB services where we provide prenatal and postnatal care for mothers, because the incidence of infant mortality as well as maternal mortality are pretty high in the district. So our contribution to improving these health outcomes is really critical, and we are looked upon as a very important component of the District of Columbia's efforts to improve health outcomes. So I just wanted you to see this because I know many of you would want to see the services that improve the lives of babies and enable them also, the mothers who rejoice in the birth of their children. As you can tell, I'm very proud of the services we provide through our OB here in Parkside, and something that definitely improves the life of unborn and born children. So thank you again for what you as donors do. But I want to tell you now about another program we have, which is our residency and medical student training program. The service that we're going to see now is really critical. Cancer, the incidence of cancer, particularly in older people in DC, is very high. Through our partnership with Sibley Hospital, which is a part of Johns Hopkins, we are able to screen people in this cancer center. We're able to direct them then, if positive, to Sibley Hospital, where they have the highest quality care in treating and cancer, and in fact have fantastic outcomes. This is really a very special and important part of our services to DC. It just started 2 years ago, and it's something, again, I think we're all very proud of, and we're grateful to the partnership that we do have with Sibley Hospital. Sometimes we think of health centers or a health clinic as just providing medical care. But what has been really important for our patients is that we provide services that may not be available in the average doctor's office. So we're going now to see podiatry services. Podiatry services are very important, particularly to the elder population that we see. I want to emphasize that one of the populations, of course, that we serve and that are at great risk to having amputation is our homeless patients. They actually are on their feet so often. They are, so that they are prone to a lot of things in the winter, such as frostbite. So having a podiatry service is critical to meeting the needs of all our patients, but especially the homeless patients. It is important that when our patients come to the clinic that we offer them more than just physical care. What's really important is to address their overall need. And what happens here in this mental health room is that we provide counseling and psychiatric care to many of our patients. One of the big issues and challenging issues, as you've probably already heard, is overdose from drugs, and particularly highly potent drugs that are now on the market. We have really an innovative, creative program where our staff provide counseling and group therapy and self-help programs for those who are actually drug using. And we've thankfully had a lot of success with this program. Needless to say, it's something that is going to be with us for a long time. And we think it's critical to the array of services we provide at Unity, at Parkside, and indeed at other sites throughout the city. I'd like to welcome you now to our actual residency, simple place where our future doctors are trained, and I just basically, they learn remotely here. It's based on what they call Doctor of Osteopathy, which is very similar to an MD, medical doctor. However, there's a unique approach to this, where in fact the emphasis is on allowing the body to heal itself. So it's just a different model, but very equally capable to what a medical doctor does. As you can see, we have here our manipulation table, and we have here a poorly fed patient. So this, obviously, an important part of medical care is learning the various elements of the body. So as you can see, they have a lot of fun with our gentleman here who's very poorly fed. As you can see, we have a lot of services here at Unity. And this service is called WIC. It's called Women, Infants, and Children. And it's sponsored by the U.S. Department of Agriculture. And the focus here again is to support mothers and ensuring that they have the various foods and nutrients that a baby would need right after birth. Many of our women that give birth, they are financially strapped. They don't have access to a lot of services. Many of them are from other countries. This particular program is very valuable for folks from South America who are our patients, because in those areas the drug companies definitely push the formula, and our goal is to, if the mother so chooses, to be educated properly in lactation. I'm taking you now to an area and a part of our clinic that's very special to me, and that is our dental clinic. I believe that the services that Unity provides to our patients here is second to none. The environment is beautiful. It's as up to date as you would get in any clinic throughout the United States, private or otherwise. I wish I had a clinic like this growing up in Ireland. But I'd like to just take you through, walk through it and see the beautiful layout of our clinic and the services that are provided there, both by our dentist and dental hygienist. And here we go. Here at Unity, as you can see, we focus very much on the patient. The same patient that may get care here at the dental unit, maybe down over in the podiatry room the next day for care for that. So it's all patient focused. And the reason it's patient focused is because our patients don't just come with one need. They come with a host of needs, whether it's ophthalmology, dental, podiatry, or medical care, or young pregnant women. So Unity tries to provide what we say a holistic approach to the care of the patient that addresses their need. We like to say one-stop shopping. We like to say the right place, the right time, and the right care. I'm probably out of my depth explaining this, but this is a panoramic, and this panoramic enables the patient to be x-rayed, all full mouth x-ray. Again, it's without doubt, it's one of the highlights of our dental staff to be able to provide this service, because in the past they were just using regular x-rays. But this is very, very critical, again, to the needs of our patients. And not to mention, it's very, very expensive, and I would have to say that it's probably one of the few such units among community health centers. Now, Parkside is one of our unique sites. Not all of them offer such comprehensive services. But again, here is another service that's critical to our patients. I'd mentioned about diabetes, which has a major impact on many of our patients, and some of the side effects of diabetes is eyesight, lack of eyesight, or the need for improved eyesight. As you can see, just like you would find in any of your ophthalmology when you visit the ophthalmologist, the services that are provided here, again, are second to none. I have such confidence in the ophthalmologists and that provide, and the optometrists who provide care here, that on 2 occasions when I had at work an eye infection, that I came here because I knew that I would get great care, and I knew that the people we hire are very qualified to provide the highest quality care to our patients. I hope you enjoyed our tour of Parkside. We're glad you could be with us today, and we hope that this has enabled you to understand a little more clearly the kind of services that are provided by a community health center such as Unity Healthcare.
Thank you, Vince. What a wonderful tour of Unity's Parkside Health Center. I don't think many realize that in the last 35 years, Unity has grown to over 20 traditional and non-traditional health sites and serves over 104,000 individuals annually. It is important to note that the first neighborhood health centers were launched in 1965 as a small demonstration program by the Federal Office of Economic Opportunity, the lead agency in Lyndon B. Johnson's War on Poverty. And building on that vision of comprehensive community-based services, physician leaders, Drs. H. Jack Geiger and Count D. Gibson Jr. pioneered the founding of the first 2 health centers in the nation at Columbia Point, Dorchester, Massachusetts, and Mound Bay, Mississippi, launching a movement in urban and rural areas across the country. Today, community health centers like Unity serve more than 30 million patients across the country. This extraordinary accomplishment is something for us all to celebrate. Locally, the story of Unity started out right here in the building behind me. What was then known as Pierce Shelter, a homeless shelter for men, launched a small space with a big dream. Healthcare for the Homeless Project was born in February 1985 out of the belief that every person, no matter their circumstances, has a right to quality healthcare. In late 1985, Healthcare for the Homeless Project moved to the newly renovated Christ House. And in 1997, Healthcare for the Homeless Project officially changed its name to Unity Healthcare, as services were expanded from not only serving people experiencing homelessness, but to providing primary and specialty care to all district residents. Unity is always working to better meet the needs of our patients and has invested in electronic medical records, telemedicine, and specialty services so our patients can be guaranteed access to the highest quality of care, no matter where they live or how much money they make. Earlier this year, the unexpected onset of COVID-19, as you can imagine, turned our world upside down. Thanks to Clark Construction, one of our many partners, we moved quickly during the month of March to erect isolation tents at 5 of our health centers, specifically for COVID-19 testing. Hopefully, most of you haven't had to visit one of these tents, but in a moment, we'll visit one so you can see firsthand what happens when someone needs to be tested for COVID. Today, we continue to be on the front lines of the pandemic, yet resources are challenging. Federal funding is diminishing due to high demands, routine outpatient visits have dropped dramatically, and we're losing patients who fear being tested for coronavirus will land them on a list to be deported or may risk getting them a possible infection. We've had to pivot to telemedicine with video and phone visits in order to maintain contact with our patients and provide continuity of care. Yet the need to provide preventative and primary care services to the most vulnerable among us was already massive before COVID and will become even more challenging. Community health centers like Unity Healthcare are rooted in the community to always be there as a safety net to help prevent the need from patients having to go to hospitals. What does all this mean? Today, the future of community health centers is critical. Unity Healthcare has been responsive for 35 years, and we look forward to another 35 years serving the families throughout the District of Columbia. Community health centers represent some of the best ideals of American society: compassion, inclusion, and equality. We're so glad you have joined us today in celebrating the future story of Unity, focused on a healthier you and healthier communities. Thank you for your generosity and caring spirit during these unprecedented times. Now, let's take a look at one of our COVID-19 testing tents.
Hello, my name is Dr. Jessica Henderson Boyd, and I'm the Chief Medical Officer of Unity Healthcare. I joined Unity about a year ago, and shortly thereafter, COVID-19 hit. We actually didn't even know it was COVID-19 then. We knew it was coronavirus, and we were assessing the situation and what it would mean for our patients and for our staff. So pretty early on, we realized that we would need to be available for the community. Our patients were still at work. They weren't working remotely. They didn't have as many opportunities to socially distance, and so they really were going to be at risk in this pandemic. Early on, we started rapid respiratory evaluation clinics, and we had to do these inside at the time. And so we had providers who were willing to test patients, and the patients would come in and get their test, but then we would have to wait an hour after that test before we could even have our environmental services staff go in to clean the room. We had to do a deep clean to make sure that there were no additional viral particles there. And that took 20 minutes, and then we needed to wait another hour for the rooms to dry. And actually early on, we were almost at a 4-hour time because the guidelines weren't clear at that point. So we knew we weren't going to be able to help very many patients if we were only being able to use a room every 4 hours. So we started to think about ways that we could service more patients throughout the day and really be able to offer this service over an extended period of time, so extended hours, because our patients were still working. When we really look at a rapid evaluation tent, it's critical because it provides good air exchange and it allows us to not have so much time in between patients for cleaning. And so this allowed us to see many more patients. So we were very lucky. We had a provider who actually had been overseas and created mobile hospital units using tents. So she had a lot of experience in the processes and workflows and what we would need to do to set this up very quickly. And then our COO worked and partnered with Clark Construction to get tents set up at 5 of our centers very quickly. So within the first month of the pandemic, we had 5 respiratory evaluation clinics set up to provide service to patients, really in extended hours, on weekends up until 8 p.m. And so this was a great benefit to the community, and we were able to greatly increase the number of patients that we served. So let's think about the experience that a patient has when they're coming to get tested in the clinic. So first, even if they'd like any visit, they can stop at our front door and get screened. And we have our staff prepared in protective equipment to ask a few questions. Have you had a cough? Have you had a fever? Have you had nausea, vomiting, or diarrhea? Have you lost your sense of smell or taste? Some of those symptoms that we know are linked with coronavirus. If they answer yes to any of those questions or have had a contact with a person with coronavirus, we bring them into the tent for further evaluation. So since we're going into the tent, I'm going to put my mask on. Let's say I screen positive. We give every patient who screens positive a mask that will help protect the staff and protect them from any viral particles in the tent. So let's go ahead and step into the tent now and see. So these tents were constructed to withstand weather because we would like to use them over the seasons. Coronavirus lasted longer than we anticipated, but it will really have taken us through the spring, summer, into the fall and winter, and able to maintain this environment, which is really optimal for testing patients more quickly and more patients. We wanted to have tents that could withstand the elements and also be air conditioned in the summers and warmer in the winters so that we could use them throughout the year. So if we step inside, this is one of our tents. And you can already see that we have sort of a screening section here where they're able to take some vital signs of the patients and also help to make sure that they have access to sanitizing materials to help reduce the spread of infection. You can also see that we have several stations set up, and that's because we designed the tents to be able to be flexible in terms of the capacity that we can manage. So we might have medical assistants, we might have providers in here so that we can process more patients and see them when demand is very high. And additionally, you can see that these chairs are of a hard material that makes it better for infection control. You can see the breeze that's come through the tent, and that's part of helping that air exchange to reduce the potential for infectious spread. Here we have a PPE station, and this is really critical. This is where our team can get ready for the day. So we have gloves, we have equipment for them to be able to do the testing, we have disposable stethoscopes here, and this helps to reduce spread from patient to patient. We have disposable blood pressure cuffs. So a lot of equipment is needed to help make sure that patients stay safe and the staff who are taking care of them stay safe. And then we also maintain, because we had to change the process by which we see patients, we have a lot of paperwork here just to make this process as rapid as possible, but also to make sure it's as thorough as possible, that we're collecting the history and physical information that we need to be able to help diagnose the patient, do an assessment, and create a plan to help them feel better, no matter what the cause of their illness is today. And joining us now is Dr. Krista Chapman. She's actually the medical director of one of our sites that has a respiratory evaluation clinic. And she actually has been a tireless soldier in this fight against coronavirus. She was one of our first providers to work in the indoor respiratory evaluation clinics, and then was able to take that practice outside. And one of the really great things about having our primary care providers work in the tents and help provide this service is that we're able to keep them connected to care. So Krista is also wearing protective equipment today. And she's going to show you what a test is like, and she's going to test me. And if you recall, I'm in the type of equipment we give to the patients who are sick, and Krista is in pretty much full PPE to protect herself and others from getting the virus. So Krista is completely protected today. And so because of that, it's actually okay for me to take my mask off now for her to be able to do the test. So Krista's probably going to be able to go and get a swab. And there are many ways that Krista can get a sample. So the most common way is doing a swab in the nose. And this has changed a bit over time, but she just needs to take a cotton swab, almost like a Q-tip, and run it on the inside of my nose. Now, not right at the tip, and hopefully not right at the back of my head, but somewhere in the middle. And she gets some of those cells and then puts it into the viral media culture. Okay? Now, Krista got that from two sides of my nose because she wanted to make sure she got enough of a mucus sample that, you know, if I'm sick, that I find out accurately if my test was positive or not. So I'm going to put my mask back on to keep all of us safe. And Krista would label that sample, get it off to the lab, and the lab results come back usually in about 2 to 5 days. And as I mentioned, then our providers will give the patients a call with some additional educational material about how they can manage their illness. It's been great having the respiratory evaluation clinics so close to our community health centers so that we are able to provide that information and education and that service to patients in their communities and close to home. This has been a challenging time, and we are just honored to be able to serve the community, and we thank all of our donors for helping to support us in that endeavor and for being partners so that we can meet the community's need during this time.
Thank you, Dr. Boyd, for giving us a fascinating look at what it takes to go through COVID-19 testing. I feel fortunate that I get to work at Unity Healthcare, not only because we have such a wonderful team of individuals and have such a positive impact on the lives of so many, but also because of the generous support that we receive for donors that care so much about providing a safe and equitable healthcare experience for all our community. One of those donors is CareFirst Blue Cross Blue Shield. As a difference maker, they understand the challenges being faced by everyone in our community every day and are willing to think creatively and generously to find solutions. Thanks to their generous donation, we now have a brand new health mobile to serve our many patients. This health mobile will allow us to tackle the transportation barrier many of our patients face on a daily basis and bring their health care directly to them on the streets, in the parks, and in their neighborhoods. But enough from me. I'll let CareFirst tell you about it themselves. Dr. Ramjan?
I'm here! Hello, my name is Destiny Simone Ramjan, and I am so proud to be Vice President of Community Health and Social Impact with CareFirst Blue Cross Blue Shield. As Shalon mentioned, we at CareFirst like to think of ourselves as difference makers. Each and every day, CareFirst and our Community Health and Social Impact team are inspired by organizations like Unity Healthcare. The commitment to excellence that frontline heroes at Unity display each and every single day in the lives of their patients and the communities they serve inspires us to make good on the CareFirst mission of providing access to high quality and affordable health care in a safe, compassionate environment to all residents of our region. And at no time is that mission more essential and vital than in light of COVID-19. When it became clear that we were entering an unprecedented pandemic, CareFirst pledged to act. We invested $5 million in our personal protective equipment initiative and pledged an additional investment of $2 million through our COVID-19 grant-making strategy, which provides relief to communities' health, social, and economic needs. This past summer, we supported 49 organizations to minimize food insecurity for families, children, and seniors, and to test up new COVID sites, to name a few. I'm especially proud to report that Unity Healthcare has been a trusted partner in initiatives like these, including being the recipient of over 7,000 units of vital personal protective equipment, such as face masks, gloves, and gowns, with much more to come. But our partnership with Unity did not begin with COVID-19. In fact, since 2004, CareFirst has invested over $2.5 million in a range of programs, event sponsorships, and services. Our commitment to accessible quality healthcare is front and center in our partnership with Unity. And this has been demonstrated, perhaps best demonstrated, with an investment we made just last year to support the mobile unit, which increases access to care to those who are experiencing homelessness and unsheltered populations throughout Washington, D.C. This $177,000 grant recognizes that there are vital primary care services that can only be provided by a mobile unit. Annually, this mobile unit is positioned to provide over 1,500 patients access to compassionate and comprehensive health care and wraparound services, utilizing the latest technology and some of the aforementioned PPE equipment, of course. CareFirst's initiatives and Unity's track record as a leader and innovator in the patient-centered, value-based care model is a natural fit for us, because we share a vision of outcome-focused approaches to community-based and public health impacts, as well as a transformation of the healthcare experience with healthcare in mind. We are so grateful for your partnership with Unity, and we look forward to our shared vision of making healthcare more affordable and accessible for the communities where we live, work, learn, play, and pray. We're so excited to see the first in line mobile unit. Take it away.
Welcome. We're excited today to welcome you to an important aspect of Unity Healthcare's medical care, and that's our Healthcare for the Homeless medical van. I'm Dr. Ann Cardile. I'm Medical Director of Healthcare for the Homeless, and I've been with Unity for 16 years. Somebody who's deeply important to the mission of Healthcare for the Homeless and the history of Healthcare for the Homeless with Unity. And with Unity as a whole is our Chief Medical Officer Emeritus, Dr. Janelle Getches. Dr. Getches?
Well, this is a blessed day. Welcome. This van just allows us to be present with people who normally don't get health care. You know, when Healthcare for the Homeless was initially founded in 1985, DC was one of 19 cities that were chosen. Our emphasis to begin with was to go into the shelters, to provide health care directly in the shelters. But very quickly, we began to know we need to be on the street too. And because many people who are on the street just will not come into a health service, they're on those park benches, they're back in the crevices of the building along Pennsylvania Avenue and other places, they're in encampments. And these are folks who probably have not had any health care for a long, long time. So they're some of the very sickest folks that we see. And this van, and we're so grateful to CareFirst for providing this van for us. But this van literally means often for people the difference between life and death. So we're very, very grateful. Thank you.
And as Dr. Getches mentioned, we're so grateful to CareFirst for the donation of this van. So please come on, let's see what's on board. We wanted the first thing people to experience when they first come on the van is the hospitality that we want to express. So we had designed a poster to help highlight the smiling faces of Unity's providers, and with the center, Dr. Getches, who's deeply important for us all. And a reminder to all of us, both as providers and patients, of the deep importance and the legacy of Healthcare for the Homeless within Unity. So come. The other important part of anything that we do in outreach is our case management and social services. So this little nook will be our case management location. Our case manager will be here with patients. Okay. Next, right over here. Next to the patient, we'll see the medical assistant. And so we have just a little area here for patients to have their vital signs taken, their sugar checked, etc. So that will be right here. Vaccines, etc. And then come next. The next spot is the area here with the provider, and we'll have an opportunity here to have private conversations with patients and to develop trust and to attend to their medical needs. So this will be, of course, the exam table here. We'll have it also set up for our ability to do pelvic exams for women if needed. We'll have medications here and be able to discuss with patients and be with patients as we help take care of some of their medical needs.
Thank you, Dr. Cardile and Dr. Getches. That was really wonderful to see. And I want to say a great big thanks again to CareFirst, Blue Cross, and Blue Shield for sponsoring Unity with the Health Mobile. Unity Healthcare is able to provide care to more women, men, and children, especially those who would never be able to afford treatment because of the support we receive from our many partners and special donors like you, especially during these fragile and challenging times. We thank you. We are stronger together because of all of you. Unity serves a very indigent population in many of our poorest communities throughout the district. Did you know that Unity serves 1 out of 7 DC residents? Unity is a significant solution to providing critical care to those less fortunate. Know that you are part of this solution. Your investment in Unity has helped us serve over 104,000 individuals annually. We are stronger together because of you. Together, we will fulfill our mission and continue to save lives. In 2021, for us to continue to fulfill this mission as we have done for 35 years, we of course appreciate and count on the philanthropic support that you carry and share with us going forward. Ongoing support is always needed for individuals who are experiencing and facing homelessness, depression, mental health, cancer, and addiction issues, infant mortality, and access to care for our seniors. And of course, we don't turn away the uninsured. We provide care for all, regardless of ability to pay. We are so proud to be the largest network of community health centers in our nation's capital, providing comprehensive care to over 104,000 annually. And yes, you have made this possible. We are stronger together because of all of you. Thank you. So far, we've taken you inside our Parkside Health Center, into COVID-19 tent, and you've toured our Health Mobile. Now I'd like to show you what life is like within our homeless walking outreach team. Dr. Catherine Crossland is Unity's Director of Homeless Outreach Development. Several times a week, she goes out and quite literally walks the streets of DC to help our most vulnerable population, those experiencing homelessness. Reaching that population isn't easy, but during a pandemic, even harder. Let's see how Unity is changing the landscape and bringing healthcare to those on the streets during this unprecedented time.
So it sounds like there are a few people that you wanted me to see today.
Yeah, okay, and actually I see one of them right now. Let's go check on how he's doing. His name's Matt.
Okay, wonderful, thanks.
Hey Matt, how are you?
Hey, so nice
to see you. This is Dr. Crosland.
Hi, so nice to meet you. Adriana has been telling me about you, and so I wanted to come and check on you and see how you're doing.
Okay.
Excellent. Do you mind if I check your blood pressure?
Yeah, that'd be fine. Yeah.
Okay, great. So, do you have any history of high blood pressure?
No, it's pretty average.
Yeah,
you know,
every
a little
once
bit
in a while.
high though.
Yeah. Okay. So, do you have a primary care provider?
I've been using Unity Health.
Oh, wonderful. Which
Yeah.
clinic do you go to?
Well, sometimes you guys come out to me in the field.
Great.
And as well as sometimes I've been to the one on 2nd and D.
Oh, perfect. CCNV.
Yep.
Excellent. That's fantastic.
Yeah.
And do you take any medications?
No.
No? Okay, wonderful. So you've been pretty healthy. That's good to know. So, you know, we are really concerned about folks such as yourself who are outside right now, especially as it's getting colder. Do you mind telling me how old you are?
57.
57. Okay. So I don't know if you've heard, but we have a program that we have started with the city, with the Department of Human Services, to try to get folks who are staying outside or who are in the shelter, who are over the age of 55 or with certain medical conditions off the street so that they can be protected during the pandemic. Is that something that might be interesting to you?
Yes, definitely.
Yeah? Okay. So my name is Catherine Crossland, and I have worked with Unity for 12 years. I started out as medical director for the homeless outreach sites, so I helped to manage essentially all of the clinics serving people experiencing homelessness outside of CCNV Clinic, which is I think of as like our mothership, but all of the shelter-based clinics at 801 East and New York Avenue and Adams Place, as well as the clinics that are based in our day centers, like the Downtown Day Services Center or Adams Place Day Center. And then finally, I have worked to sort of develop and strengthen our street medicine program. Unity is, I think, really ahead of the curve in terms of street medicine because we've had a mobile outreach van since 1987. We partner with organizations all over the city that are already doing outreach, and those organizations such as Miriam's Kitchen or Pathways to Housing or Georgetown Ministry Center, who we actually started our kind of street medicine as we know it, that program, as well as Everyone Home DC. So there are a number of them throughout the city. We partner with them, and their outreach workers are in the community every single day. So they know the folks that are living in their area, and they can encourage the patients that they're concerned about to see a physician. And so then when we show up on our scheduled Tuesday morning, we can find the person, and our partners know where that person has been, typically for the past few days, and then they kind of vouch for us and say, you know, this is Dr. Crossland, who I've been telling you about, and she just wanted to ask you a few questions and maybe check your blood pressure, and then we kind of start the relationship from there.
They always come through, you know. It doesn't really matter as long as it's, you know, decent time of the day. I can always call and they answer, and I tell them, you know, what I'm dealing with, and they'll give me some type of answer. So, you know, they've always been available and there for me when I've needed them. I think that they make services available that otherwise would not be available, you know, being in my position. They actually bring it out to us, and, you know, a lot of people have a hard time getting around or getting to appointments and stuff like that. So, you know, they could pretty much come to us and unite us with the services that we needed.
Homelessness looks a lot of different ways, right? Not every person experiencing homelessness got to their situation by the same path, and living in a shelter is different than living in doubling up in a friend's house. But living on the street is a particularly challenging situation, and I feel like so many people look down on folks who are living outside, and I really love the opportunity to show care and love to people who have often been the most marginalized, and to just have people hopefully feel in some way that they are loved and cared about.
Thank you, Dr. Crossland. You are amazing. And what you do continues Unity's legacy of service to the homeless population for over 35 years. And thank you to all of you who have joined us for this special virtual event. Just remember, there's no Unity without you. So please stay safe, be well, and I would hope to see you sometime again in the near future. Thank you.
Unity has a tremendous network of connections to the community. And as you know, for healthcare today, we really need to be closer to communities.
The Greater Washington Community Foundation has been a long supporter of Unity Healthcare. We are just incredibly proud of the way that Unity serves our community.
We see centers like Unity continuing to be hubs of high quality, community-focused, person-centered care. And I only see a brighter future because FQHCs are truly the backbone of healthcare delivery in this country.
Here at Sibley, we've always been impressed with Unity's resilience and their ability to rise above and beyond, particularly in light of our COVID-19 pandemic.
Heroes. Compassion.
Indispensable.
I want to be somebody who matters, and I want to see the world from higher heights, and I want to dream and watch in different shadows. Could it be that we could make it right? Oh, we've got everything we need just to change the future. You know it's buried deep inside our chest. If we weren't so afraid to bleed from the words of others, we could just let our hearts beat and love the rest. Oh, we've got everything it takes just to make a difference. You know it's buried way inside our bones. If we weren't so afraid to break from the weight of failure, we'd help the broken everywhere we go. You know, I wanna be somebody who's braver. I wanna feel responsibility. Oh, 'cause it's real. I could be a lifesaver. Can you see the possibilities? Oh, 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 we got everything we need just to change the future. You know it's buried deep inside our chest. If we weren't so afraid to bleed from the words of others, we could just let our hearts beat and love the rest. Oh, we've got everything it takes just to make a difference. You know it's buried way inside our bones. If we weren't so afraid to break from the weight of failure, we'd help the broken everywhere we go. You know, the world is a broken place. We see it every single day. Can't turn our heads and walk away. We've got to find the strength to say no more. No more. We've got everything we need just to change the future. You know it's buried deep inside our chest. If we weren't so afraid to bleed from the words of others, then we could let our hearts beat and love the rest. Oh, we've got everything it takes just to make a difference. You know it's buried way inside our bones. If we weren't so